Information on the topic, the objectives of policy and practice being implemented. My name is Rhiannon Moffat, a third-year nursing student at the University of Technology. For this assessment, I am going to discuss the prevalence of violence in the emergency department and the effects this has on patient safety and a healthy workplace. This is an extremely prevalent issue in contemporary society. The aim of this presentation is to provide education on the effects of this issue, not just on patient safety, but implementing and maintaining a healthy workplace. The problem being addressed throughout this presentation is the prevalence of violence in the emergency department and the implications this raises on patient safety and a healthy workplace. These violent acts are defined as physical assaults and threats of assault directed at nurses on duty. In 2018, New South Wales hospitals experienced over 2.9 million emergency department presentations. It is estimated that 90% of emergency department staff has experienced a form of violence in their career. Worryingly, evidence suggests that only 30% of incidents are reported. The increases in ED visits have significantly increased stress associated with this, which increases the potential for violence against nursing staff. Violence in the emergency department is becoming a significant problem that affects patient safety and a healthy workplace. It is a widespread epidemic throughout the healthcare system. The incidence of violence has increased due to a multiplicity of precipitating factors. Patients and their loved ones are under stress in their ED environment, which can lead to a lower threshold for aggression and a greater risk for inappropriate behavior toward healthcare professionals. Moreover, additional factors include long waiting times, alcohol and substance misuse, and lack of aggression minimization training, which all contribute to the issue. Nursing staff have the right to work in a safe environment, whilst patients and visitors have the right to receive healthcare in a therapeutic environment free from risks to their safety and from any exposure to violent acts. New South Wales hospitals have put forth mandatory requirements to maintain a zero tolerance approach to healthcare, as well as founding work systems that facilitate and promote a zero tolerance approach. The National Institute of Health and Clinical Excellence Guidelines for Prevention and Management of Violence recommend that a review should be taken place within 72 hours for all parties involved. The government has introduced a statewide program for nursing staff to reduce hospital violence for emergency department nurses. New South Wales Health is training emergency staff to manage disturbed and aggressive behaviours in the wake of serious assaults in the state's hospitals. This will provide nurses with techniques to de escalate aggressive behaviours which will maintain safety. These violence prevention programs have been put in place to alleviate violence related risks. When this cannot be achieved, they must be limited to the lowest possible level. Whilst the government and healthcare system is working toward improving the issue, the incidence of violent behaviours needs to be reduced through effective behavioural management. Violence in the emergency department is a significant problem that affects patient safety in a healthy workplace. Violence in ED affects a healthy workplace and poses a significant occupational safety hazard for nursing staff, and as a result of the frequency, nurses are underreporting violence, which puts patients and staff at further risk. This can have significant impacts on patient safety through the downstream effects it arises. As a result of nursing staff experiencing violence toward them, patient perceived quality of care is affected. The frequency of violence in ED has implications that significantly affect a healthy workplace. As a result of violent episodes towards nurses, they have significant effects on the healthcare system. Workplace healthiness is affected through more sick leave, decreased productivity, staff turnover, and workers' compensation payouts. Violence toward nurses in ED results in acute stress, loss of productivity, which has negative impacts on the nurse's ability to perform their duties, thus affecting patient safety. Effective leadership can assist in mitigating the prevalence of violence against nursing staff through the de-escalation of the situation before it escalates further. Research has indicated that nursing leadership is increased by education, programs, and healthcare organisations which unite to mitigate the problem. Through effective leadership, all nursing staff working in the emergency department can be well equipped with efficient techniques and reporting procedures that will minimize the risk of violent behaviours. The government has introduced a statewide program for staff to reduce hospital violence for emergency department nurses. Effective leadership can help mitigate this problem through nursing staff working together to de escalate aggressive behaviours and maintain safety. Leadership in nursing ensures that nurses consider patient safety as a priority when performing nursing care to achieve optimum patient outcomes. As a new graduate nurse, it is expected that practicing within legal, ethical scope and boundaries, this ensures the delivery of safe practice and fulfilling their professional roles. This can be achieved through working accordingly with the code of conduct which nurses must adhere to. Working as a new graduate nurse will require working accordingly with the policies and procedures to prevent and mitigate violence in the emergency department. Firstly, legally, it is essential as a new graduate nurse to understand the legal obligations of reporting violent behaviours. This is not only paramount for patient safety but also maintaining a violence-free workplace. The Work Health and Safety Act 2011 outlines the legislation that imposes it is the professional responsibility of the nurse to assist in controlling or eliminating all risks associated with patient violence. The New South Wales Health Policy also outlines that all threats and incidents must be reported to prevent and manage intimidating, threatening, disturbed, or violent behaviour in hospitals. Secondly, it is a crucial responsibility of a registered nurse to implement the person-centred practice to maintain the well-being of the patient. As a nurse, providing leadership ensures the delivery of safe and quality care and understand their professional responsibility to protect the patients, document and report all concerns to ensure the patient's safety is maintained. Providing safe and appropriate quality nursing care is essential in maintaining a healthy workplace that is safe for all patients. Thirdly, providing safe, appropriate and responsive quality nursing care must be delivered to all patients. This means practicing in accordance with all New South Wales guidelines, standards, regulations, legislation. Concerning violence in OUD, this means following the appropriate processes to report all issues that endanger patient safety and a healthy workplace. Conclusively, the effective leadership will help prevent violence in the emergency department through the implementation of policies to prevent violence. This is achieved through current research policies and effective workplace communication. The contemporary research and policies support the need for change to reduce the prevalence of violence against nursing staff in the emergency department. This is being achieved through a statewide program for nursing staff to reduce hospital violence and statewide policy implemented to help manage and reduce the prevalence of this issue. Violence in ED has not only a negative impact on psychological and physical well-being of healthcare staff, but it also affects their job motivation. Through the implementation of contemporary research and policy, it seeks to lessen the burden upon nursing staff and promote a healthy, safe workplace environment. Whilst the policies put in place are essential at preventing this issue, however, in the emergency department setting, communication will help mitigate this issue. This presentation aims to provide detailed information regarding the prevalence of the epidemic violence in the emergency department and highlight the risks this poses to patient safety and nursing staff. This presentation is being used to communicate the topic, displays effective leadership through incorporating audio and visual learning to convey the importance of this contemporary issue in healthcare.